Well, the holiday season is a time for family, for friends, for fun. It's also the time when we get colds and flu and other illnesses as well. Tonight, we are joined by certified physical assistants, Whitney Crane with Cone Health LeBauer Healthcare at Oak Ridge to talk about how to stay healthy and what to do if a loved one does get sick during the holidays. We're going to start with prevention. What are some top recommendations for how to stay healthy and avoid being sick this time of year?
Yeah, so obviously, most of us know washing hands and covering our coughs, but the question is, do we do them appropriately and effectively? First thing with washing hands, of course, it's a full 20 seconds. And if you're like my children, it's a race to get who to the dinner table first. So sometimes that actual effectiveness of, scrubbing your hands, counting to 20 or singing happy birthday is not done appropriately. That's first and foremost. Second of all is don't cover your cough with your hands. Of course, we cover it with our elbows because then, of course, the next time you shake someone's hand, you've effectively just passed that virus along. Along with prevention too is, of course, vaccination. I hear in the clinic all the time, oh, I don't get the flu shot because it gives you the flu. And of course, that's not correct. A lot of the times the flu shot, when you might feel symptomatic for 12, maybe 24 hours after getting that vaccine, of course, that's your body starting to create an antibody response, which is in essence what we desire and what we are hoping for. Plenty of hydration, rest, these are all very, very important for doing so. And lastly, for prevention is understanding that most viruses do have something called an incubation period, which is the time frame after you've been exposed to the time frame of having symptoms. Many of us, maybe a mom or a dad is sick with the flu, and we send our children to daycare anyways because they are asymptomatic. But unfortunately, we can somehow still spread the flu that way before we are exhibiting symptoms. So keeping in mind thick contacts, close family members that have been ill, trying to prevent that further spread by keeping sick family members at home.
All right, so it always happens. People get sick. So what should we do if someone in the household gets sick so we don't spread it?
Exactly. And that can also depend simply on the symptoms that somebody is having. For instance, most of these viruses are spread via droplets. So the easiest way for it to be passed is if someone is actively sneezing or coughing. Somebody that's sneezing or coughing, of course, you can either have them wear a mask, they can be isolated in a room. If you want to have a family encounter with people, the 6 foot rule is not new, even though we all learned about it because of COVID. Having them spread away from where that potential droplet would affect them is one of those recommendations.
Okay, so inevitably someone's going to get sick and you're going to need some help with that. What options are available during the holidays when someone gets sick and your doctor may or may not be open?
So there's actually a lot of options, particularly through Cone Health, which is where I work. I've done urgent care and virtual care, and these options are available 7 days a week. With urgent care, this is a good opportunity to get that testing done when your doctor is not available. Um, Virtual visits is in essence similar to what I'm doing right now. It's a video visit where you speak with a licensed practitioner, and they are also available 8 in the morning till 8 in the evening time, Monday through Sunday, so 7 days a week, including holidays. This is a good option for some of those minor symptoms. Of course, if you're exhibiting serious shortness of breath or chest pain, that would not be appropriate. There's lastly something called e-visits as well. If it's just something that you have a short little answer or question for, a rash, a sniffle, a cough, you can actually submit. It's more of a questionnaire online, and you don't have to talk with anybody directly, and they will usually respond within an hour or two with direct answers to your questions. So really, there's a vast array of different places that you can go.
Okay, and no doubt you're going to have guests. They come from out of town, they get sick. What happens if you have a guest who's from out of town, they're sick? What options do you have to help them find help treatment?
So believe it or not, you don't have to be a Cone Health patient to do the virtual care option. As long as you are physically in the state of North Carolina, we can give you that treatment through both the virtual care and the e-visits. Obviously, a visiting family member is more than welcome to go into any of the urgent cares as well. Um, So I work in the family practice, and we do have an option also for virtual care through your own family doctor. Obviously, those are slightly restricted hours during the normal business hours of your family practice, but that, of course, is an option for a family member as well.
And this is always the debate. Where should you go for care? When should you go to urgent care versus the emergency room?
Believe it or not, urgent care actually is capable of dealing with a lot of different symptoms. Typically, emergency room should really be kept for those that are dealing with emergent issues. If you are having difficulty with breathing or feeling extremely short of breath, chest pain, please, those are appropriate for the emergency room. If you're having a fever that's responding to Tylenol or ibuprofen, some sniffles, a cough, those would be appropriate for the urgent care setting in which we could do diagnostic testing. Also, urgent care does have capability of diagnostic imaging and labs as well. So there's a wide variety of treatments and things we can do for urgent care.
All right, we're going to continue this conversation. We'll be back in just a few moments.